Welcome to the HIPAA and OSHA Compliance in 2025 webinar. We are excited, both Empower Healthcare and Anatomy IT, to discuss these topics today. And really, these are topics that are becoming more and more front and center for healthcare organizations, really focused on protecting your patients and your staff. So our conversation is really designed to help you confidently navigate HIPAA and OSHA compliance concerns as they continue to evolve and change very quickly. I am Bill Centeris. I am the Chief Product Officer at Anatomy IT. I'm going to go through a few housekeeping items, and then I'm going to introduce our speakers for today. So first off, all participants are in listen-only mode, but we are going to be accepting questions, and we're going to go through them at the end. So please don't hesitate to put questions in the Q&A component of the Teams channel or the Teams event. And then we will also be sending out the recording from this webinar in the next 24 to 48 hours if you want to share it with your team. And if there's any challenges during the webinar, please don't hesitate to pop it in the chat or the Q&A, and we'll take care of it. With that said, I'm very excited to introduce our panelists. I'm going to let them do their own introduction. So first off, I'm going to start with Dawn, if you wouldn't mind doing an introduction.
Sure. Thanks, Bill. Welcome, everyone. Thank you for attending today. I'm Dawn Meglino. I am Anatomy IT's HIPAA compliance specialist. In my role, I conduct HIPAA security risk analyses for clients as well as non-anatomy clients, write weekly HIPAA tips, attend numerous webinars, speak at different seminars and webinars for ASCs, work with hospitals, ambulatory surgery centers, small organizations, as well as very large organizations, and very excited to speak about HIPAA and OSHA today.
Great. Thank you so much, Dawn. It's great to have you on this and sharing your knowledge here. Our second panelist is going to be Mitch from Empower Healthcare. Mitch, would you like to do an introduction?
Sure. Thank you so much. It's nice to see how many people are excited about compliance at their lunch hour. Yep. Everybody thinks compliance is a non-revenue generating department. So congratulations, and I'm sorry for joining us today. But my name is Mitchell Brie. I am the CEO and founder of Empower Healthcare and Compliance Partners. We're a full-service risk, due diligence, and compliance firm. We are national. We are based out of Bergen County, New Jersey. And we have a team. We have a great partnership, obviously, with Anatomy. And what we're going to talk about today is all the exciting new, or as we like to say new, compliance is something that is not negotiable. Compliance is not something that you can decide when and what you want to do when you do it. And at the same time, we do try to make it somewhat entertaining because of the fact that when we look at compliance as a whole, and we'll get into this a little bit more, whether we're talking about safety, et cetera, or HIPAA corporate compliance. But we're excited to be here. And as Dawn said, we have clients all over the country, ranging from one doctors to hospitals, MSOs, medical, dental, et cetera. So thanks so much. Looking forward to chatting with everybody here for a little bit.
Great. Thank you, Mitch. That's fantastic. Always want to make compliance fun, and it looks like there's some excitement around compliance in the chat already. So I think we're on the right track. So for our agenda today, I'm just going to do a quick overview of that, and then we're going to jump right in. So what we're looking at today and what we're hoping you gain from it is a few categories. First off, what are the proposed HIPAA updates, and what do they mean for you in your practice? How the new OSHA priorities, including updated PPE rules and employee safety training, are shaping compliance in 2025. Really important topics for healthcare organizations. We're also going to go into what to know about the OCR's risk analysis initiative and rising enforcement trends. We're also seeing the increase in ransomware, so we're going to talk about why ransomware and cyber threats are putting real pressure on HIPAA and patient safety. And then just some practical steps that you can do to align your IT and compliance programs without disrupting the quality of care to your patients. So those are the agenda items that we're going to talk through. And with that, I'll stop speaking and just ask some questions of our experts. And Dawn, if you don't mind, I'm going to start with you. And I would love to start with HIPAA. And I wanted to ask you, what are the most significant changes proposed in the 2025 updates? And with that, what should organizations be doing to prepare now?
Thanks, Phil. So with the notice of proposed rulemaking that occurred in 2025, nothing has changed as of yet, but this is what we really have to look at. We need to strengthen cybersecurity protections. That's really what this all revolves around. We'll discuss that a lot today in the course of the webinar today. Examples, contingency planning and incident response plans. Big deal. Very, very big deal. You can call it contingency planning. You can call it disaster recovery planning. You can call it business impact analysis. That is a HIPAA requirement, and it has to be in place. And it's being proactive with your organization. Another category would be updated technical safeguards, such as multi-factor authentication, wherever and whenever you can enable it. Vulnerability scans, encryption on EPHI in transit, encryption on EPHI at rest. Enhanced security risk analyses, more comprehensive when you're conducting one. So those are really some of the key things that we want to look at as far as the changes. And they're the basics, but they're it. They're super, super important. I'm going to turn it over to Mitch. I'm going to let him add on to what I just said.
Thanks so much, Dawn. So I'm going to go back to the basics here. So the first question, we could always say the joke is everybody needs to know how to spell HIPAA. And we know that it's gotten good enough that you can actually autocorrect it when you're actually writing an email, that it actually will autocorrect it for you, whether it's 2 P's or 2 A's. One of the things that we always look at is we'll say, hey, do you have an approved compliance plan? And that will start with HIPAA privacy and HIPAA security. Those manuals are usually separated. So one of the questions we'll always ask is, do you have an updated HIPAA manual? And updated means post-COVID. There were certainly some mechanisms. So I know we're talking a lot about 2025, which of course is very important. Everything that Dawn said is very accurate. I'd like to also go back and go, how about 24, 23, and 22? Because there were a lot of changes that happened post-COVID. So if you haven't had an update to your HIPAA manual since COVID, that's certainly something that you want to look at from a privacy as well as a security side. You also want to look at things and we'll talk a little bit more about assessments, but we certainly want to make sure that you have all of your BAAs in place for anybody that may have access to any PHI within the practice. You want to make sure that if you're doing in-house billing, billing policies and procedures, making sure that your training is done, which I know we'll get into in a little bit as well. And that includes cybersecurity, of course. Also harassment. 4 years ago, it was called sexual harassment. Now it is just straight harassment. But most importantly, we always ask everybody flat out, do you have an approved compliance plan? And do you have HIPAA privacy and HIPAA security? That's historically where we will start. So we'll go backwards and then go from there. Obviously, cybersecurity is a very big piece. We call it the three-headed monster. So we'll have legal, we'll have compliance, and then we'll have technology, the IT side. They all need to talk to each other, especially if you're looking at risk analysis, security risk assessments, pen testing, vulnerability scanning, things like that. So that's a lot of the stuff that we see. So thanks so much.
Yeah, that's great. And I think as you start to dig into it, there's just so many questions that will come up, and I'm sure we'll get some. But as you look at what the OCR Risk Analysis Initiative is, so that's a mouthful, OCR being the Office for Civil Rights, they have a risk analysis initiative going on right now, and it's getting a lot of attention. Mitch, can you explain what that is and what that looks like will be sufficient in the eyes of the OCR?
Well, so the word here is, and a lot of these things are, proposed, right? So let's just look at the word sufficient. And I'm going to live on that word for a second. So we have 2 rules that we deal with, especially, we'll deal with OCR when it, if you're hiring a new employee, if you're letting go an employee, what rights are, what's approved. OCR gets very involved in training. So if you're looking at certainly different training in terms of a risk analysis, there's different kinds of risk analysis. You have a security risk analysis where, and I know Dawn will probably talk about this as well. Rule number 1, if you have an electronic health record, you need an analysis. It is not negotiable. You must get a security risk analysis if you have an electronic health record. If you don't have an electronic health record, I'd certainly love to have a chat and hear how you've managed to avoid that for all of this time. But I think we live in this world of 2 things. Like, right, one is going to be the just because you can doesn't mean you should world. So there's a lot of things where we'll look at common sense, especially in the world of compliance or what you can do from a security standpoint and go, well, just because I can do something, or well, I think we were talking about this yesterday. One thing would be if you're going and you're adding anything to your practice or you're removing anything from your practice, whether it be a new office, whether it be new software, those are all things that are considered sufficient risks. Anything that can cause, I hate the word hack, but we certainly need to make sure from, updates in regards to passwords. One thing that is definitively a sufficient risk will be the amount of time that it takes for your screen to blank out or lock. We're walking into practices where we see 5 minutes. We also see a couple of where it just doesn't lock. Can't do that. So we certainly want to make sure that we're talking with Dawn's team or, from an IT standpoint to go, well, what are those timeframes? Is it a minute? Is it 2 minutes? Is it 30 seconds? Do we have privacy screens? These are all things when we walk into an office or if we see an OCR issue, first thing, or if we're doing any type of HIPAA check, first thing I'm doing is walking to see what information can I see without really having to do anything. And it's usually at the front desk. Rarely, rarely is it, let's say if it's the providers, unless they're using scribes. But a lot of it, we used to have this joke, and I'm not sure how many billers we have on the call, but there was always a joke that used to be that 80% of the reason why somebody didn't get paid was because of something that happened before the doctor saw the patient. That's now actually gone into this side of it because there's most of the fines that are out there are for something before the patient even gets into the room. Sorry for that long-winded version. No. The word sufficient, it really should be more insufficient. But with that, I know Dawn's definitely got some additional stuff that she wants to throw in there.
Yeah. Well, just before I pass it over to you, Dawn, I think sufficient is always an interesting word, especially when you're talking about cybersecurity and threats. And you mentioned the changing landscape of adding new systems or removing systems. So maybe, Dawn, you can talk to us about how do you assess that? Because we hear a lot about penetration testing, vulnerability scanning. Can you talk about the difference? And then what specifically should a healthcare practice focus on? And Mitch talked about walking in and just seeing what's happening, but there's so much more you can do.
Thanks, Bill. I want to just add with the risk analysis initiative, the main reason that this is occurring, and it is occurring, if you subscribe to OCR's newsletter, you'll see this in some of the breaches. You will see that there is no risk analysis that was conducted. So the reason that this came about, the OCR's risk analysis initiative, is because this still isn't happening. And this is your foundation for your business. So if you're not conducting a risk analysis or a security risk analysis, you don't know where your vulnerabilities and risks lie. I mean, it's as simple as that. You need to know who's touching, what's touching, your EPHI, your PHI, and how it's protected. That's the bottom line here. Going into the penetration testing versus the vulnerability scans are an assessment, a security assessment of your network, your systems and your applications. It could be an internal scan, it could be an external scan. So as an internal scan, as an example, let's say missing patches, outdated software. Those are examples of an internal scan that could pick up something like that needs to be corrected, obviously. And again, this would be a vulnerability and would be an opportunity for a threat actor to get into your systems or applications. When you're talking about a penetration test, you're talking about, let's use an example of a firewall. So you have a system that something is trying to get into from the outside. So someone is trying to penetrate into your network or into your environment. And the best example that I can give you, or the simplest example, is through the firewall. We change IT companies. We change EMRs. We do these different things where we shake and we move, but we forget to dot our I's and cross our T's. We have a port left open in the firewall. Oh, wow. How exciting for the threat actor, or how exciting for a man in the middle who's just waiting for that opportunity to get into the systems. Penetration testing is very specialized. It's very, very involved. We would absolutely recommend at minimum on an annual basis to conduct a vulnerability scan. It's giving you that opportunity to see what vulnerabilities, risks, weaknesses you might have within your system that may be overlooked. In a penetration test, we look at that more as a larger organization that says, we really need to invest in this. Or let's say it's an organization that has multiple sites and some are in the cloud, some are connecting through servers, some are not connecting through servers. So there's a lot more moving parts when we think about a penetration test versus a vulnerability scan. But going back to vulnerability scan for just a second, I'd recommend it for a 1 doctor practice to 5, 7 doctors, ambulatory surgery center. It's very, very important. One of the changes to the notice of proposed rulemaking was that they suggested vulnerability scans be done multiple times per year. Now that's just a recommendation. I don't think it will ever happen because it is a burden for very small organizations to get that to happen, but they are very important.
And I, like you said, it might evolve where they have to do it multiple times a year, and it can be a burden. But the reason for these changes are because of the changing landscape. So I'm going to combine a couple of questions here for both of you. I'd love your opinions on. We're seeing a lot of news around these cyber threats and focuses on healthcare. You're seeing ransomware attacks evolving and other attacks that you mentioned. What are some of the minimum cybersecurity practices you recommend, even for small practices? So keeping that in mind. And for clinics operating on a budget, what are some cost-effective ways to do that? So maybe, Mitch, I could start with you.
I mean, the joke that we would always have is don't have your IT person be your cousin or a relative or a buddy or, well, I think we live in a world now where you have a lawyer, you have a law firm, you have software, you have a software company, you have compliance, you have a compliance firm, you have IT, you have an IT firm. I think we've moved to a point where people have gotten way too crafty. I mean, I'll give an example, right? How many people on this call, don't raise your hand because, you can, I might not see you. But how many people on this thing have gotten a text from EasyPass saying that they're about to get a fine because they didn't do it and click here to upload, do your new EasyPass stuff? How many people have gotten something from Amex saying that there's an issue or from Chase Bank is a big one. There's a problem with your account and all you got to do is click it. That's it. They've gotten so good. I get them as well, and of course, what they always will say to do is to look at the reply email sender, and then you'll see some 74 letter, and number thing. 5 years ago or 10 years ago, remember the original version of this, which was you have a $6 million grant from the king of Nigeria, and all you have to do is send me $100. And we all do kind of joke about that, but because that's the OG, right? That's the original version of the scam. And now it's click here to update your EasyPass or, whatever it may be. We're not smart enough to do this on our own. We're not. I'm not. I mean, and I'm a coder and a chief compliance officer. We're all doing 12 things at the same exact time. We need to lean on our partners that are there for that reason. So I do hear this a lot where it's like, okay, well, I'm a solo doc or I'm a 10 doc. The companies that you work with should also have different versions of their services to assist you. It is something that is imperative. I understand, with legal, they'll say, okay, well, I'm going to wait till there's a problem. I'm going to be reactive. Compliance and IT are proactive events. That is something where you do not want to wait. I think they used to do that with insurance, right? Everybody wants it. Nobody thinks they need it. And when they need it, they can't get it. If you get hacked or if you have a cyber breach, doesn't matter. Whatever you do after that is going to be reactive anyway. And then depending on the amount of patients that it affects, decides if you have to disclose, what you have to disclose, what you have to do. So I think if you're a small group or a large group, Now, by the way, if you're a joint venture of a health system, they probably have something. But for the smaller groups that are on here, speak to your vendor. And, they will all have some sort of light version, but it is not something to be scared away from as long as you're communicating and being upfront about that. So, Dawn?
I'm going to add a couple of things that, Bill, you mentioned about, smaller clinics and what could they possibly do? What's budget friendly, right? Mitch mentioned this a few minutes ago in regards to passwords. Strong passwords, long passwords. That is a no-brainer. So get away from a 7-character password that can be cracked in 2 seconds. Hello? Get away from a shared user account. Oh, we're too busy. We can't log in and log out. We can't switch users. We're not in the 20th century anymore here, folks. And the reason that the healthcare industry is attacked so regularly is because it's easy. The ransomware attackers, they're a business and they're good at it, right? So change your passwords, make them 16 characters. Don't roll your eyes at me on this webinar, because when you create your patient portal of your own, or you create your 401k or your financial institution password and it has to be reset, I can guarantee you it's going to be at least 13 characters. So that's a start, and that's very cost effective, right? Another one would be training. We have to do regular training. Everyone goes, yeah, we did our HIPAA training. We watched the video that we watched last year. Oh, great. Great. All right, let's put HIPAA like second or third. Let's think cybersecurity. Let's think security awareness. Let's put out to our staff, tell me 4 flags of an email phish. Mitch just talked about the clicking. Amazon is a great one too. And now the smishing, the texts. Hey, your package, didn't get delivered. It's not coming. What? It's 4th of July weekend. I need that for the pool. Okay, I better click on it. I better get going. We do this all the time. So for us, we just think of it as, come on, people. But there are organizations out there that offer very valuable opportunities for free training. We had talked about this in the past. HHS 405D is one of them. CISA is another one. NIST, where I know most everyone on the call will go, oh yeah, I'm not going to go to NIST. It's too complicated. But there's free training. There's free resources. There's posters. But I would say I would recommend on a regular basis training. Lastly, I would say multi-factor authentication or 2-factor authentication, especially when you're looking at your environment and you're having people connect maybe outside of a business device. So if I'm on my cell phone and I'm connecting to my EMR in the cloud, if I'm on a personal laptop and I'm connecting through to something, we don't recommend personal laptops for business work. We would say business devices if you're working from home, or a remote connection into the business environment. But a lot of organizations, because everything is cloud now, they don't feel the need per se maybe to invest the money in a business device. If you're going to do that, you need to layer your security measures.
Right. Really good stuff. And I think, your point is a very valid one. Not every solution requires a tool or spending money. It really takes just a few minutes to look at what are you doing in your landscape of IT. Are you securing it with the right passwords? Are you training your employees not to do things like click on links that they don't know or open files that they don't know? And those are some basic things you could do with training and get some really fundamental training out to all of your team. I'd like to pivot the conversation a little bit from HIPAA compliance and cybersecurity and talk about OSHA compliance and workplace safety. And Mitch, I know you have a lot of experience with this, so maybe you could start off by telling us what was introduced as changes from OSHA in 2025, and what are some top updates that providers should know?
So OSHA, like HIPAA, is another one of those mandatory things. We have, you kind of have 2 different sides of OSHA, right? You have patient safety, and then you have doing your annual OSHA walkthrough. So I had said previously, certainly making sure that your HIPAA manuals are updated. You certainly need to make sure that you have an updated OSHA manual. And that's going to relate, so one of the big changes that's kind of out there is that, OSHA is a federal program, and they're talking about bringing it down to the state level so that the state can make more money if you end up getting fined. But certainly one of the things that we'll look at, we do a ton of OSHA walkthroughs as well as OSHA training. So sharps containers, let's not have them underneath the sinks in all the rooms. Can we please put them on the walls? Can we please go ahead and check all of the expiration dates on everything that's within your practice, whether it be depending if you're orthopedics or GYN, everything from alcohol, everything has an expiration date, everything. A lot of the reasons why a lot of people went into OSHA violations is because during COVID, they stopped their McKesson or whatever it was that was delivering their medications or their supplies to them and didn't realize, oh, well, we'll sit there and go, well, what if it, is expired a little bit? Try milk, expired a little bit. It goes bad real fast. So certainly need to go ahead and look at that. Things we'll see also eye wash stations. We'll see fire extinguishers. We'll see, things like, is there stuff on all of your refrigerators that say food only? If you have any type of medication and they have locks on the doors, you got to lock them. And you got to lock them at night. That's state statute is you can't, especially if you have a cleaning company or anybody that might be coming in, you certainly need to make sure that all of that is protected. And then at the same time that you're actually also going ahead and you have an inventory. If somebody steals something, how do you know? Let's not leave drawers open with weapons in them. No scalpels and scissors and things that a patient can certainly go ahead and take from that piece. Also want to look at, if you have multiple offices, things that will be in the safety side will be, are there cameras outside? Are there cameras and are they turned on? Do you have a hotline for, so by the way, remember, when it comes to OSHA and HIPAA and any type of violation that's reported, historically speaking, it's not going to be a patient. It is going to be a disgruntled employee. We have that wonderful whistleblower word. And, as I say, usually right about now, everybody on this call is thinking about who might be a whistleblower in their own practice. And if you can't think of anybody, historically, it's you. So we certainly want to go ahead and make sure that we have an updated OSHA manual. Our fire extinguishers are up to date. We're keeping daily logs of vaccines or daily logs of medication. I certainly want to make sure, like I said, we do all of our OSHA training because that is something. I actually was with a practice. Hold on a second. I actually got to make sure that these people aren't on this call. I actually went into we did an OSHA training and it was like, remember when we were all young and we went into school and they were like, hey, if there's a fire, hide under the desk made of wood. I remember those days and you'd sit there and go, well, it's the same thing as like if you get caught and a bear, meets you, what do you do? And they go play dead. And they go, well, who wrote that? The bear? So we sit there and we go, we need to make sure that we're following updated OSHA guidelines. For some, you want to have code words in case there's, what we call MOAP, management of angry people, in case of active shooter, which is something that unfortunately is real and does happen across the country. And it's something that you need to be prepared for from a safety standpoint. And obviously there's an OSHA piece from workplace safety that deals with cybersecurity. You can have an employee that'll go and download information from your system. You better have an audit log as to what someone has security settings. The last one in regards to that is for anybody that uses a CRM, like a Salesforce or a HubSpot or whatever, any type of software, depending on what it is that they're doing, you need to make sure that there are policies and procedures in place for what each individual can and cannot do. You do not want certain people getting access, especially people like in a call center. So if you're dermatology and someone from a call center is uploading photos, you need to make sure that they don't have the ability to run reports. So these are all things that you certainly can talk to your IT side about and Dawn and her team, but you certainly want to make sure if you have those things that there are settings in place for employees of what they can and cannot access. Same thing with an electronic health record. Someone who works in the front end shouldn't have access to clinical data. They shouldn't have the ability to look into somebody's chart. Granted, if you're an X-ray tech, well, then you have to be able to put intake in, but that's about as far as you should go. So it's really important for anybody that's on a health record to make sure you're either speaking to your IT or make sure that you're speaking to your vendor in regards to the privacy and security settings that are in there, because those are all the things that will set off safety issues. Dawn?
So I wanted to mention something that I read about with the OSHA updates, which I found very interesting, and I think it's extremely important that everyone is aware of it. There are penalty adjustments coming, or they're already in place. I'm not sure, Mitch, probably you know that, both up and down. So in serious violations, the costs are going to go up as far as the violations. So the dollars are going to go up. And then there was a mention of smaller organizations, if they were to remedy the situation, I don't want to say situation, the violation that they had when OSHA walked through, if they remedied that in an expedient manner, they would have a lesser violation, or they would have to pay a lesser violation.
6 months. Yeah.
So that's something to keep in mind when we're speaking about OSHA, for sure. Now, going back to a couple of things Mitch had said, when he was talking about, somebody not having the ability to go over here in a computer, we're talking content filtering, and we talk about this all the time. Our basic thing, and the thing we always say is, does anyone really need to go to Facebook on their business device? Does anyone really need to go to Instagram on their business device? Now, some organizations use LinkedIn, they use Facebook for business purposes, but not in the clinical area, I would say. You're going to maybe use it in HR. You might use it with the managers or in the administrative area, but it's not necessary. And that's something that in the technical environment, computers can be blocked. This section is over here. This section doesn't have the ability to go shopping or to go over here or to go to Instagram or TikTok or whatever. And these computers over here can. So that's one of the other things I wanted to mention or elaborate on with what Mitch had said. And then again, going back to what he had talked about with who has access to where, that's our minimum necessary rule. We can't say it enough, right? Minimum necessary rule. So Dawn is on this level and Mitch is on this level. And so Mitch has this much more privilege in a software solution or in a system or in an application. Dawn should not have those privileges if it's not necessary for her to do her job. So we do need to look at those role-based access, minimum necessary, and we need to lock down systems, networks, shared drives. Oh, well, it's our shared drive. Well, what do we store in it? Everything. Great. No, that's not great. Not great at all. So again, some things to think about, and some things that really aren't, again, as we go back to what we talked about earlier, not big deals. We're not talking about changing the whole environment.
Yep, agreed. And I would say for both HIPAA and OSHA compliance, whether it's through the research that you all do, or whether it's a whistleblower or an event that happens, somebody gets injured or not, the whole goal of both of these is that we want to protect patient data. We want to protect patient and staff safety, right? That's the root of it. So regardless how you learn about the issues, fixing them is really important to those things, right? Protecting patient data, protection patient and staff safety. And they can seem like a lot, but the reality is you'd rather do it before it becomes an issue. So even if it is a whistleblower, it's great to hear what the issues are so you can focus on it. So look, we have a few minutes left. I probably have one more question that I'd like to ask before we open it up for questions. And Dawn, maybe we can start with you and talk about what are the top 2 to 3 priorities for a practice administrator to tackle in Q3 or Q4 of 2025 to really stay ahead of these concerns that we've talked about?
I would say, especially because we're on the heels of Q4, right? Q4. Conduct your security risk analysis now. If you have not done for 2025, that would be first and foremost. If you do not, as we said before, you don't know where your vulnerabilities, your risks, your threats lie. This is the basis. This is the foundation. So we start with this. Update your policies and procedures. Mitch mentioned this before. It has to reflect everything current. In the event that there's an audit, in the event that there's one patient complaint to Office for Civil Rights, OCR will contact you. They will say, we're going to have a desktop audit. We need to look at X, Y, and Z. We want to look at your policies and procedures. I will tell you, if they are dated 2021, 2022, they're going to look at you and they're going to say, you can't tell me nothing's changed in 3 or 4 years. Very, very, very important. And going back to what we've been talking about, which is educate your staff, train your staff, ongoing, continuous. Doesn't have to cost a lot of money. You certainly can enlist your whether it's your compliance organization, Empower, whether it's Anatomy IT with some kind of cybersecurity or security awareness training. Great, fantastic. We would love to, both of us would love to do that. It's very, very important to keep that in mind and keep that on an ongoing basis. And I think lastly, Bill, I would probably say enlist others. What tends to happen in organizations is we conduct the security risk analysis and everybody's gung-ho, or one person is gung-ho, and then things start to fall by the wayside, or we get one of the technical scenarios fixed, or one of the technical safeguards. And then all of a sudden you have your policies and procedures, and then we have a crisis, and that doesn't get addressed. You really need to have some kind of a team, even in a small organization. It's possible. You get the person that really likes to read through things and combs through things and puts together the manual and updates the manual, where you've got the other person that loves to be the cheerleader and gets in there and does all the training for you and makes sure that it's documented. So I think really, if I were to say what they need to do, the risk analysis, ongoing training. Once the risk analysis is completed, look at the most critical areas of weaknesses within the organization. If that is technical, if it is encryption, you're going to have to look at enabling encryption. If it is multi-factor authentication, go for it. Very, very important.
I really want to thank Mitch and Dawn. Thank you for your time today, sharing a lot about HIPAA compliance in general, and then obviously the OSHA challenges going into 2025 and getting ready for 2026. Great partners here. And if anybody has any questions after the call, you have contact information for both here. And then if you, and mine as well, just email us, and it would be great to catch up and talk about some of your challenges. With that, we're going to say goodbye and close out. Have a great day, everyone.